Good afternoon, good evening, good morning, dear participants, excellencies, dear colleagues. I'm Shariful Islam, representing the Minamata Convention Secretariat. Welcome to today's online event organized by WHO, World Health Organization. This is the 8th of the 21 online events organized in the banner of COP5 online events. COP5 events are an informal platform for parties and observers to share informal information and bring knowledge to advances in technology, research, and policy to the attention of the parties and to the global community that the convention serves. Here we embrace informality as an opportunity for innovation and collaboration, bringing together a spectrum of stakeholders to explore fresh alternatives and solutions. Your participation adds depth and richness to our discussion. Before we move on to before I hand this over to the moderator, let me go through a few housekeeping notes. So as you can see on the slide, you may wish to test and adjust your speaker and microphone settings by opening the audio and video menu at the top left corner of your screen. You can open the participants panel and the chat panel by clicking the respective icon at the bottom right corner of your screen. You may also wish to type questions and your comments in the chat box, and please send it to everyone. If you need any technical assistance, please put your message in the chat box and send it to the host. And kindly note that this session is being recorded and broadcast live on our YouTube channel. Thank you. Over to you, Gabby.
Thank you, Shariful. And hello, everyone, and welcome to the COP5 online event, reinforcing the health sector's commitment to the implementation of the Minamata Convention on Mercury, the showcase of JEF, UNEP, and WHO projects on mercury-added products. My name is Gabriela Sardon, and I'm a consultant in the oral health program at WHO headquarters. And I'm delighted to be your moderator for this event. Next slide, please. So in the screen, you can see what we have planned to share with you today. We will start with a brief introduction on the Minamata Convention and the role of the health sector in its implementation. And we will then have individual presentations on 3 projects to support countries in phasing down the use of dental amalgam, eliminating mercury-containing skin lining products, and phasing out mercury measuring devices in healthcare. Moreover, we will learn how projects' benefits can be multiplied through the Global Mercury Partnership. After the presentation segment, we will have a panel discussion with country representatives from the 2 projects that are currently underway. And the closing remarks will be provided by Dr. Leslie Onen from WHO. Before we begin, to all our attendees, thank you for being here, and we hope you enjoyed today's event. And we invite you to share any questions or comments you may have through the chat box. Our team and speakers will be monitoring the conversation, and we'll be able to respond as needed. Next slide, please. So the Minamata Convention on Mercury is a global treaty that aims to protect the human health and the environment from anthropogenic emissions and releases of mercury and mercury compounds. It addresses the whole life cycle of mercury, from supply to trade to use, emissions, releases, and disposal. Next slide, please. Next slide, please. Thank you. Article 4 of the Convention outlines the obligations that parties must comply with in relation to mercury-added products. There are many products listed in Annex A of Article 4, but in this slide, you will see only the mercury-added products that are relevant to today's event. Annex A Part 1 includes a list of products, including skin lining products and measuring devices, both with a phase-out date by 2020. And Annex A Part 2 includes a list of provisions that should be taken to phase down the use of dental amalgam. Parties must implement 2 or more of the 9 original provisions, and they must also implement the 2 mandatory measures agreed by the COP4, which are in gray color in the table. These additional 2 provisions enter into force last month. Next slide, please. It is clear that human health is at the core of the convention, and as such, a leading role for health ministries can be envisaged in health-related articles, such as Article 4 on mercury-added products, but there are also other articles highly relevant to the health sector, notably Article 16 on health aspects, which highlights the need for consultation and collaboration between the Conference of the Parties and WHO, but also the articles on mercury waste, information exchange, research, development, and monitoring, to name a few. So whether it is at country or at global level, we can see there is a place for the health sector in supporting the implementation of the convention. Next slide, please. And this is my last slide. There are two World Health Assembly resolutions that are relevant to the implementation of the convention. The resolution adopted at the 67th World Health Assembly in 2014, public health impacts of exposure to mercury and mercury compounds, the role of WHO and ministries of public health in the implementation of the Minamata Convention, and a more recent resolution on oral health adopted at the 74th World Health Assembly in 2021. In line with these two resolutions, the three JEF-funded projects to be presented foster the active participation of Ministry of Health and its close collaboration with Ministry of Environment in the implementation of the Convention's obligations. And the projects are also aligned with the mandate given to WHO to cooperate closely with UNEP and other relevant international organizations and bodies, and to provide advice and technical guidance to member states to fully support the implementation of the health-related aspects of the convention. With that, I believe it is now a good time to give the floor to Dr. Benoit Varenne, Dental Officer of the WHO Oral Health Program at headquarters, who will present the first project, the JEF7 Phasing Down Dental Amalgam Project. Over to you, Benoit.
Thank you, Dr. Gabriela Sardon, and good day to all participants. It's a real pleasure to give you an overview of the JEF7 Phasing Down Dental Amalgam project started this year in March 2023. I think it's really an important project because we know that the end of the use of dental amalgam is being experienced as a kind of stress for a number of oral health professionals after decades of practice, but it's also a source of many interrogation for those in charge of the implementation of the Minamata Convention at Ministry of Health level. And the role of WHO with its partners such as UNEP is to provide information based on scientific evidence to guide decision-making process by the parties and therefore accelerate the implementation of existing alternative strategies. Slide, please. So, of course, the project is also important because it indirectly addresses a severe public threat. I'm talking, of course, about dental caries or tooth decay or cavity. So dental caries, as you may know, affect more than 2 billion people worldwide, including more than 500 million children. So it's the most prevalent disease in human being. If you have a look to the graph on the right side of the slide, you can see that the vertical axis is the prevalence of dental caries, and the horizontal axis is the age over the life course. And this is quite important also. It's one of the characteristics of dental caries. It affects people over the life course. And so it affects deciduous teeth during childhood, as well as permanent teeth later in the life, and reaching the highest level in late adolescence, but remaining prevalent also for the rest of the life. So, of course, we have good news. The first one is dental caries is mostly preventable, and we know that the more important risk factor is, of course, sugars. And the second thing is there are medicines and preparation today that can arrest dental caries progression or restore the teeth in using cost-effective and non-invasive intervention, of course, without using mercury. So, and of course, the slide also remind you that dental amalgam is composed of a mixture of metals consisting of element mercury, more or less 50%, and a powder alloy composed of silver, tin, and copper. Therefore, is it a significant source of mercury pollution? Slide, please. So now about the CHEF project itself. So you can see the overall project objective, and you can see also that we are working closely with three countries, Uruguay, Senegal, and Thailand. And just to mention also that multi-sectoral collaboration between Ministry of Health and Ministries of Environment in the three countries are really kind of mantra, of this project and for WHO is the key aspect, to reinforce the collaboration between these two entities in countries. And of course, beyond UNEP, who is the implementing agency of the project, I also would like also to mention and thanks all the non-state actors, including academic, NGOs, WHO cooperative centers, and also private sectors that are involved as co-financing partners of this project. Slide, please. So the project comprises three major components, as the slide shows. The first one is what we call the phase down of dental amalgam used through improved policies and technical capacity. So in all the three countries, there would be a number of assessment, of the situation to understand better, but also to move through the main measures that are, of course, in the Minamata Convention to improve and accelerate the phase down of the dental amalgam. The component 2 of the project is mainly focusing on the issue of waste management, and this is quite important and challenging aspect, how to manage, how to put in a safe place this waste coming from the dental clinics in the countries. And we have a first component, we call this knowledge management and global awareness. And an important thing, of course, it's to use this component, to share information to the public, to the countries, to the ministers, to ensure that we have the same level of course, understanding of the project, but also WHO will work with the partners and UNEP, of course, to develop what we call a global technical guidance that will be based on the outcome and the success story, of the three countries. So it would be for these three components, we have a very clear and strong outputs and outcomes to be achieved by the end of this 3 years project. Important also to mention that the project component, of course, are in line with the Annex A, Part 2 of the Minamata Convention, including, of course, the amended, measures that happened during the COP4. The slide, please. So a last slide to reinforce the message about the existing synergies among the three CHEF projects that are presenting today. First, the three projects are based again on the strong collaboration mechanism between Ministries of Health and Ministry of Environment. Awareness raising activities of the Minamata Convention and the provision of mercury added product are key activities of the three projects. And WHO thinks that working to implement the treaty provision on one mercury added product can lead to the implementation of other mercury added product obligation. So each project feeds and contributes to the others. Assessment of healthcare system-wide approach to mercury waste management is, I think, a good example of a strong synergy between the three projects. Finally, I cannot end this presentation, without mentioning that one of the overarching goals of this project is to contribute to the achievement of universal health coverage for all by 2030. And as you know, universal health coverage, or UHC, means that all people receive the health services they need, so they get the right care at the right time in the right place without financial hardship. So it's definitely a very important project for WHO. And achieving UHC is one of the targets, as you know, of Sustainable Development Goal, to ensure healthy lives and promote well-being for all at all ages. I will stop there, and happy to answer any question in the chat box. Thank you, and over to you, Gabby.
Thank you so much, Benoit, for that comprehensive overview of the project and really reinforcing the message that this project also supports the achievement of universal health coverage for health and the sustainable development goals. So I would like to now give the floor to Talia Alisha from the Biodiversity Research Institute to present the project on eliminating mercury skin lining products. Talia, the floor is yours.
Thank you, Gabby, and a pleasant good day to everyone. So as mentioned, my name is Talia Alisha. I'm the International Environmental Specialist at Biodiversity Research Institute, who's actually co-executing this project on eliminating mercury skin lightening products with WHO. So as we all are aware, mercury is a highly toxic element, and it's been used throughout the centuries in different processes because of its unique properties. And one property in particular is that when mercury and mercury compounds have been added to cosmetics and products that are applied on the skin, it actually has a property that inhibits melanin production. And melanin, of course, is what gives our skin its pigment, its natural color. So in recognizing this and the fact that also topical application of mercury onto the skin has detrimental health impacts, under the Minamata Convention, as mentioned in Gabby's presentation earlier, cosmetics that have over 1 part per million are not allowed to be manufactured, imported, or exported by parties. But of course, this is very complex issue to actually implement because of the fact that mercury in cosmetics is very unregulated globally. While the limit is 1 part per million, in some products that we've tested, there are products that have over tens of thousands of parts per million of mercury. Many products are unlabeled or mislabeled. So there's a real need to address this issue in a very coordinated approach. And there's also the need to understand the social stigmas that actually drive the use of these products in the first place. So in recognizing that, next slide, please. In recognizing that this project is a medium-sized project by the GEF that was developed. So it's a project that's funded by the Global Environment Facility, but also by several co-financing partners, primarily the governments of the participating countries, which are Gabon, Jamaica, and Sri Lanka, which were chosen because of their position in regions that have skin lightening product issues that are prevalent. The project itself, and also other co-financing partners also include different NGOs that already have a lot of work that's been done on skin lightening products and are sharing those resources under the project as well. So the project is implemented by UNEP. It's co-executed, as I mentioned, by WHO and BRI, with technical support provided by the Global Mercury Partnership. Next slide, please. And through this project, there are 3 main components that are very similar in format to the project we just saw in the previous presentation. So the first component is to build capacity on legislation, enforcement, compliance, and awareness raising strategies within these countries. So the main goal is that the manufacture and trade or import and export of these products need to have specific legislation and policies to adequately address them. So under this project, the needs for the different legislation will be assessed and recommended, and there'll be a strong network of different government agencies, as well as the private and public sector, that can work together under the project to really address the issues caused by it and amplify enforcement. Under the second component of the project, which is to reduce or stop production, trade, distribution of skin lightening products in project countries, the main goal is to increase the understanding and ability to monitor these products. So under this component, we will be building the national laboratory capacity for actually testing products that are coming in so that we can understand what is the mercury concentrations of products that are being manufactured and ones that might be coming into the country. We'll also be looking at monitoring the online markets and online trade to really try to address the issue overall. And we'll be doing a number of testing under the project. So BRI will be testing different products that are sampled under the project, as well as the national labs that are identified and capacity enhanced for, in order to develop a database that can be used by the ministry, by customs, by Bureau of Standards, etc. Under the third and final component of the project is to take what's been learned within these project countries and make sure that it's shared globally for more enhanced approach across the globe. So under this, there will be a global advocacy campaign that's going to be developed by WHO in coordination with the Global Mercury Partnership, a community of practice, which entails a project stakeholder group that's already been formed, and I believe their meeting is going to take place next month, the first meeting. And it involves not only stakeholders from the project countries, but also globally, persons and NGOs, private sector, public sector, personnel, etc., that have been doing work on skin lightening products overall. And of course, in order to share the information that's been developed under this project and to share resources that are already available, a knowledge hub will also be developed. Next slide, please. So to provide a little bit of example of some of the activities that are going to be provided under this project. So one of the key activities is that under the component 2, all skin lightening product mercury concentrations that have been analyzed under the project and that have been provided through verified resources through the project stakeholder group, etc., will be kept in a centralized database that will be developed by BRI in coordination with the Global Mercury Partnership and will be made available to either the Ministry of Health, the Customs Bureaus, Bureau of Standards, any other personnel that might be need to understand the information in order to monitor control excuse me, in order to monitor imports, exports, and manufacture. So this database will be a readily accessible one that can easily identify with a picture, with an ID, the different types of products that have been identified to have mercury in them, and some more information on it so it can be adequately controlled in terms of trade. Next slide, please. And in terms of the knowledge hub that's been developed, so it's already live and you can access it at www.unep.org/mercury-free-cosmetics. It's an online website that will have all of the resources that are developed under the project, and any findings will also be added. And also you can use the mercury-free hashtag, mercury-free cosmetics hashtag on social media to get more information on the project there as well. Next slide, please. All right, and so to end as well, it's just really important to emphasize the fact that while skin lightening products might seem, mercury in skin lightening products might seem like a very nuanced issue, it's also linked to all the other activities that are going on under these projects that you'll hear about today, as well as some of the other activities that you'll hear throughout this week of side events, because of the fact that the mercury in skin lightening products is addressed under Article 4 of the Minamata Convention that deals with mercury added products. So in terms of the legislative recommendations, in terms of the institutions that are going to be engaged with, it's going to be a lot of the similar persons. So there's a real need to have an integrated approach and share our resources, share the information that's been gathered and the activities that are being carried out in order to have a really targeted approach to manage mercury in products and mercury management overall. So with that, I will say thank you. I feel like I went a little bit fast, but anyways, thanks very much and looking forward to any questions.
Thank you so much, Talia, for your presentation on this project. We learned from the full national reports by the parties to the convention that some of them face challenges to meet the 2020 phase-out deadline for mercury added products, including this one. So this project is very much needed. And so is the next project to be presented by Dr. Leslie Onion, head of the Chemical Safety and Health Unit at the World Health Organization. The project is titled Phasing Out Mercury Measuring Devices in Healthcare. So over to you, Leslie.
Thanks, Gabby. Yes, so this is the third GEF-funded project with a focus on mercury in medical products. This one focusing on mercury medical devices in healthcare. It's a full-size project of the GEF, and it will be carried out in 5 countries, which I'll describe to you in the next coming slides. So the first slide, please. The first slide, just wanted to basically emphasize the importance of these medical devices, blood pressure measurement and temperature control. High blood pressure is used to identify individuals at high risk of cardiovascular disease. And we know that cardiovascular disease is one of the most important risk factors in the global burden of disease, and it is one of the key targets for achieving the health-related SDG goals and tackling non-communicable diseases. However, more than 700 million people in the world have untreated hypertension. So whilst we want to eliminate the mercury-containing blood pressure devices, then it's important that we maintain access to devices that can measure blood pressure, and that we have some innovation there to bring down the cost of these instruments. Similarly, maintaining a core body temperature is a very important part of allowing our bodies to function properly, and raised body temperature is one of the first alarms of an infection or other forms of illnesses. We see that there are many modern non-invasive devices coming on the market to measure blood pressure, and we have a picture of the old-fashioned type here that's been in use for several hundreds of years, and the digital variety. And similarly, none of us can be of not seen the diverse range of temperature monitoring devices which are coming onto the market, and what we saw during the COVID-19 pandemic, where we had handheld infrared guns, and as well as the more classical like baby type thermometers, which are digital. So this is an area where there's a need to continue innovation and to make these continue access to these devices. So we have to really manage the phase down in a very careful manner. Next slide, please. WHO has already done quite a lot of work in this area. We do have a unit dealing with safety of medical devices, as well as my unit dealing with chemical safety. So we'll be bringing the strengths of both units to bear in this project. We have WHO has published a lot of information on how to implement the Minamata Convention, and we have this very useful publication, an annotated bibliography of WHO information, which covers not only the medical device area, but the dental amalgam and skin lightening, artisanal small-scale gold mining. So it's a very useful a go-to reference source. But when you look in this bibliography, you'll see there's a number of important technical guidance already dealing with the phasing out of mercury-containing thermometers and blood pressure measuring devices, including a step-by-step for developing a national strategy, which is the one on the middle one down in purple, as well as the more technical specification orientated guides, which are necessary, as I said, to maintain that the devices are functioning properly and meet key performance specifications. So, of course, when you phase out one device and you introduce replacements, you need to make sure that they're still the devices are functioning to a prescribed performance level. We also have guidance on decommissioning medical devices, and also some of the waste disposal aspects there. Next slide, please. So the project is similar into the ones that you've heard about already. It has 3 key components. The 5 countries which the project is going to be implemented in are 2 countries in Africa, Uganda and Burkina Faso, 2 countries in Europe, Montenegro and Albania and India. the three components of the project. The first is developing national health system-wide approaches or strategies. This is necessary because a country can have different types of healthcare facilities. As we know, we have the doctor's surgeries, we have the big tertiary level hospitals, we have community health clinics, we have public and private, and so there's a mix of different components of the health system where we need to make sure that we're moving on a common front. So there's a need to understand that by doing situation assessments, stakeholder engagement, establishing the metrics for being able to monitor how well the project is going in terms of eliminating these measuring devices, as well as capacity building. The second pillar there in pink is very important because it concerns the procurement strategies that are needed to be changed to bring about the system change in the way that medical devices are procured. And as I said, that the technical specifications of the replacements is an important aspect there. So the identification, training, guidance and demonstration of waste management is also very important. The project sees that there'll be a demonstration of the success of phasing out in 3 of the 5 project countries and a phase down perhaps in the other 2. In India, India was the only country where there's any significant manufacturer of mercury-containing medical devices. And so there are some special assistance, technical assistance that will be needed to be given in the Indian context to bring about that phase out and phase down. And then the third component, which is common to the other projects you heard about this afternoon, which is about knowledge management and global awareness. We'll obviously be wanting to build on the lessons learned from this project. We will want to update technical guidance and develop new guidance where it's needed. We want to see some new technical guidance on the management of mercury-containing healthcare wastes. And again, the good practice examples disseminated using WHO channels as well as through the UNEP Global Mercury Partnership. Next slide, please. So when we're looking at the 5 countries concerned, each of the countries have taken some steps to already phase down the use of mercury in medical devices. And some of them have got local rules in place. So we're not starting from a zero sort of level playing field. However, the sheer number of these devices that are in use is quite notable. In some of the countries, we still have a very high use of some of the devices, like this slide says in Montenegro, 91% of all thermometers used in their healthcare facilities are mercury-free. But in Albania, which is a neighbouring country, only 24% of them are free. So there's some different sort of dynamics going on there. We see that the turnover of these medical devices is an important aspect to consider because for thermometers that break very frequently, we need a different approach to the sphygmomanometers or blood pressure measuring devices, which have a much longer lifetime. So there'll be different replacement strategies that need to be developed and implemented. The value of this project is really when you consider that the total mass of mercury that's in use, because every home has a thermometer, every hospital goes through multiple thermometers every day. So just a very first general quick estimate is that in these countries that is 1,154 kilograms of mercury in thermometers and 55,000 kilograms of mercury in sphygmomanometers. As I said, India is the only country in the 5 which is still manufacturing mercury-containing devices, and India is obviously one of the largest medical device markets in the world. So again, this will be a very specific focus for the project. However, the good news there is that in India, many of the manufacturers are still manufacturing mercury-free electronic thermometers as well as the mercury containing thermometers. So hopefully the switch over won't be too much impact on local livelihoods and so on. But that's an important consideration as well in this project. Next slide, please. So what are some of the key barriers and challenges? Procurement-related issues can be very complex, particularly when the mercury-free alternatives are not readily identified and certified as performing up to scratch or better. There seems to be some entrenched views of the medical professions, particularly in relation to the sphygmomanometers or blood pressure measuring devices, where some of the medical profession think that is the gold standard, so are reluctant to use the mercury-free devices. So there's a lot of education there that needs to be done. Manufacturing-related challenges, particularly in India, particularly in some of the smaller scale manufacturers, which may be smaller scale but can be probably the only source of income in some towns and small cities in India. There are a number of regulatory considerations as well as the need for coordination and cooperation between ministries. So I think, Gabby, that's my last slide. Just check. Yeah, thank you. Happy to answer any questions. This project is just on the verge of getting started and underway, and so we hope there'll be much more news from the project in the coming months. Thank you.
Thank you so much, Leslie, for your presentation on this exciting upcoming project and for sharing with the audience as well WHO resources that is available. You can find some of the links to these resources in the chat box. So we have now heard about each of these projects, and now I would like to give the floor to Kenneth Davis from the Global Mercury Partnership so we can learn more about how the partnership can help in multiplying the project's benefits. The floor is yours, Ken.
Thank you very much, Gabby, and thank you so much to WHO and all the organizers for inviting me to speak. I am going to speak very briefly about the UNEP Global Mercury Partnership and specifically about the support that the partnership is providing and will provide in these projects with the goal of eliminating mercury in the health sector. Next slide, please. So the Global Mercury Partnership, I think quite a few are familiar, but just a few highlights. The partnership actually was founded back in 2005, where it was instrumental part in building momentum and catalyzing what would eventually become negotiations for the Minamata Convention on Mercury. Now, with the Minamata Convention in force, the partnership supports the implementation. That's the primary objective, and in particular supports immediate actions to reduce the harmful effects of mercury pollution. Partnership does that through providing knowledge and science on relevant mercury topics, and also in outreach and awareness raising materials and initiatives towards global action in service of this objective. The partnership is comprised of over 250 partners, and it's multi-sectoral and multi-stakeholder. Partners come from governments, from NGOs, civil society, private sector, and we have a big contingent as well from academia and the research community. And the partnership is also multi-sectoral, meaning it's structured around partnership areas. And I won't read the partnership areas on the screen, but the ones that are most relevant for these projects are the Mercury and Products Partnership Area and the Mercury Waste Management Partnership Area. Each of these partnership areas has partnership area leads that coordinate the work of those partners on the topics. Next slide, please. So we already saw actually the knowledge hubs from the skin lightening products and the dental amalgam products project. So this will allow me to make up some time. I won't go over these again. In addition, the links to these knowledge hubs are in the chat already. I think Eureka already put those in the chat. And so these are part of the partnership support towards information dissemination and knowledge management in these projects. And I think it was also mentioned by one of the speakers, the importance of bringing health ministries and environment ministries together. We also see our role as important in that respect. And we also hope that we can expand our own partnership network to more health sector partners, because this and actually many other Mercury issues require close collaboration with health and environment authorities. So yeah, this is the Dental Amalgam Knowledge Hub, again, containing news, resources, and events about the topic and the project. And we'll move on, because I do know we need to make up some time. So this last slide is really the main focus about what I want to tell you in terms of the partnerships support, and that's a focus on mercury waste management. This is one of the areas that we're bringing together work on all three of these projects, and also really in the whole products and waste universe in the Minamata Convention. So what we've heard from parties and from partners for many years actually is that managing mercury waste, in particular the waste from mercury-added products, is a serious challenge for many parties, particularly for products because these are dispersed waste sources. They involve collection, they involve many different types of waste, many different methods that are needed for pretreatment. So we know that this is a challenge. Even when we phase down or phase out products, as Leslie mentioned in her presentation, significant stocks persist in society. So we have all the mercury in dental restorations that are still in people's mouths. We have the sfigs and the thermometers. And so these are stocks that are going to generate waste for many years. That's part of the challenge. And finally, we have a challenge where environmentally sound waste management solutions are not always available in all countries, and even sometimes in whole regions. Some of the waste treatment is quite specialized and is currently only found in a few countries. And so we also face challenges with getting the waste to those facilities, dealing with export, dealing with storage and things like that. So with these challenges in mind, through our network of partners and through our contribution to these projects, we are exploring, piloting and documenting waste management approaches that will help decision makers not only in these projects and not only even in the mercury medical waste sector, but really for parties that are managing their mercury waste from all sources. So that's the contribution that we are going to make in this waste management together with all the great partners and the countries in these projects. So I'm gonna close the presentation there. I know we've got great panelists ahead, and looking forward to hearing from them. Thank you so much.
Thank you so much, Ken, for sharing about the partnership and explaining the technical assistance that it can provide to these projects. Like you say, mercury waste management is a big challenge. It's on getting reported, so it is great to have the partnership on board for the technical assistance. So with that, I would like to thank all the speakers for their comprehensive overview of the projects, the support, and for already even sharing some of the synergies between them. We will now begin our panel discussion with country representatives from two of the projects that are currently underway. So we have today Mr. Patevier from Ministry of Environment of Senegal, Dr. Heather Brown from Ministry of Health and Wellness, Jamaica, and Dr. Ange Mibintu Moulet from the Medicines Agency of Gabon. So a warm welcome to all of you, and thank you for participating in today's event. I think we can start with our questions now. Perhaps a good time to stop sharing the screen so we can see our panelists' videos on, and we can start the discussion. So let's start with Dr. Ange Mibintu Moulet. Dr. Ange, can you hear me? Yes. Hello, Dr. Ange.
Okay,
Thank you. Thank you. Gabon is currently one of the countries implementing the project on eliminating mercury skin lightening products. So my question to you is, how will national activities support scaling up the project's results globally? And what platforms is the project using to facilitate information exchange at national, regional, and global level? Over to you, Dr. Ansh.
Okay, thank you so much, Gabri. Thank you so much to participants for their presence. I will begin by introduce myself. I'm Dr. Ange Binzoumouele. I'm a general manager of Drug Agency of Gabon, and I obtained my PhD in pharmacy and diploma in regulator of management of pharmaceutical supply in HIV, tuberculosis, and malaria. In the course of my professional career, I held proposition of deputy of pharmacy at the Libreville Teaching Hospital and the chief of pharmacy of Akanda Teaching Hospital. And I was advisor of Ministry Health Coordinator of Health of WHO and consultant for healthing. For my best understanding, the drug agency is implementation agency of the project in skylifting product elimination in Gabon. It's a public institution under the responsibility of Ministry of Health. The main responsibility of drug agency in Gabon is to certify and control drugs quality and another medical device in the country. My background is a pharmacist. For today's call, I have some well answered the two questions provided. If we have time, in the case my explanation is not clear, we can discuss in its further. Our support will be based on the quality of result. In our case, 3 regulatory texts are currently in the process of being signed. The text banning cosmetic contain mercury in excess of 1 ppm. The text banning dental amalgam in Gabon, whatever is used, and text banning mercury device, thermometer, blood pressure gauge, in accordance with the term of Project Gabon, will make holders dole available in the WHO and all interest parties for dissemination and appropriation. The result of field survey, which are currently being prepared to provide the factual data needed for the better understand for the problem of skin whitening, will also be used on a global scale. For example, the characterization of product in circulation current practice and distribution channel will be better now. Scientific publication and press articles will be used to share this knowledge. International conference such as forthcoming conference of the practice to the Minamata Convention will also provide at platform support at global scale. At the national level, a national steering committee has been set up which, in addition to the WHO, the Ministry of Health, and the Ministry of the Environment, bring together to stakeholders, in particular NGO, university, and research institute. The text formalizing this committee is currently being signed by government. However, the work is being carried out the basis of the agreed time date. On a sub-regional and international level, a schedule of exhaust exchange by telephone call once a month has been initiated. More specifically, Gabon will take advance for the fourth meeting to step of exchange with will we be present. Over. Thank you all participants. Thank you, Gabriel.
Thank you so much, Dr. Ange, for sharing with us what you have planned for the project and perhaps also other projects or initiatives to to phase out or phase down these products and also learn from the work being done in Gabon. Thank you. And next is Dr. Heather Brown. Dr. Brown, Jamaica is also a participant of the same project on mercury skin lightening products. My question to you is, could you please share your perspective on how important is the role of the Ministry of Health in the implementation of the convention and the need for its close collaboration with the Ministry of Environment, and whether you have some recommendations on the best practices or approaches to strengthen this relationship. Over to you, Dr. Brown. You have 4 minutes for your intervention. Thank you.
Thank you so much. Thank you very much, and good day to all participants and attendees. So as we heard earlier, the Minamata Convention aims to protect human health and the environment from the anthropogenic emissions and releases of mercury and mercury compounds. As party to the Minamata Convention, Jamaica is committed to developing and instituting a comprehensive national mercury management strategy in keeping with its obligations. The ministry responsible for the environment in its capacity as the Minamata Convention focal point is responsible for coordinating the implementation of the Minamata Convention on Mercury. However, this must be done in collaboration and cooperation with other designated ministries, departments, and agencies that have a specific responsibility for various areas for the implementation of the convention. The Ministry of Health and Wellness in particular is of course concerned with the health-related articles, the use of mercury-containing measuring devices, the incineration of medical waste, the use of mercury skin lightening products, and the use of dental amalgam are all health-related activities which have a negative impact on the environment and which ultimately, in turn, is harmful to human health in a perfect cycle. The Ministry of the Environment has its own responsibilities under the Convention to institute the necessary measures to address major sources of mercury emissions and releases into the environment, amongst other things. The ministries with responsibilities for both health and the environment are therefore inexorably and synergistically linked in the implementation of the Minamata Convention obligations. The Ministry of Health of Jamaica has, for example, phased out the use of mercury-containing measuring devices from public health facilities. Additionally, since 2019, it has discontinued the importation of dental amalgam. Under the project Elimination of Mercury Skin Lightening Products, with the support of WHO, the Pan American Health Organization, the United Nations Environment, and the Biodiversity Research Institute, amongst other international partners and NGOs, the Ministry of Health and Wellness has thus far been able to start evaluation of the extent of exposure to mercury through use of these skin lightening products. This data will be used to inform targeted activities, including awareness-raising campaigns, some of which have already commenced this year. Indeed, these are not new, as the Ministry of Health and Wellness previously embarked on one such as far back as in 2007. Regular scheduled meetings between these two ministries must therefore be an important part of the collaborative effort to ensure that objectives are met within the required timelines. The government of Jamaica is committed to the global thrust of regulating the many anthropogenic sources of mercury and their compounds. Effective implementation of the Minamata Convention will contribute to Jamaica's achievement of Agenda 2030 and the national SDGs, as well as other global sustainable development initiatives, which both the Ministry of Health as well as the Ministry of the Environment are committed to achieving. I thank you.
Thank you, Dr. Brown, for all those key messages that you just shared, and really reinforcing the need to engage with the Ministry of Health to successfully implement the Minamata Convention and other ministries as well, like you mentioned. There's so many things to talk about as well from what you've said, but we're running out of time, so I would like to now turn to Mr. Pate from Senegal, from Ministry of Environment, Senegal. Pate, it's we know that Senegal is one of the countries that it's in the project to phase down the use of dental amalgam. And my question to you is, what do you think are the potential synergies or interlinks between the three topics at country level? So, for example, how does the mercury-containing skin lining products project contribute to accelerate phasing down dental amalgam use or phasing out mercury-added measuring devices used in healthcare? So over to you, Pate.
Thank you, dear Gabriel and dear participant. And we think that we need to present you the different step of ratifying convention, Minamata Convention in Senegal to understand better these problems. And after ratifying the Minamata Convention on March 3, 2016, on August 16, 2017, the convention entered into force in Senegal. During the validation of the MIA, Minamata Initial Assessment, we realized that products containing added mercury are very, very poorly taken into account in virtual absence of data, poor control of cosmetic product containing mercury by custom and trade services, mercury device which are difficult to handle, as well as dental amalgams. Therefore, the specific international program supported a project on Article 4 during its third funding cycle. So this project, we have training trade and custom stakeholder on the synergy to be put in place to gradually reduce or eliminate certain product in Annex A containing added mercury. We are in the process today of setting up a process to develop a list of priority products to be eliminated, which we will integrate into regulation. My colleague in Environmental Minister prepare a very strong list and prioritize many cosmetic product. And when we finish this process, we move to dental amalgam product. We will first hold a national consultation, focus it on a solid communication strategy and validate directly with local stakeholders through bottom-up approach to avoid refusal among cosmetic products have network of powerful in Senegal. The problem in Senegal is the cosmetic producers is very strong. They have a big network, but we continue to improve the national strategy. From then, synergy will be put in place, and we will be able to start the different inventory and move first to a reduction, then to elimination. We recommend strongly the WHO to help us to create, if it's possible, to WHO, it's a recommendation to create in WHO Senegal an environmental department. It facilitates the collaboration between environmental ministry and WHO. Thank you, dear Zablo. It is a few information that I provide you to of your panelists. I'm a technical advisor in Environmental Minister Senegal.
Thank you so
dear
much.
guys.
Thank you. Thank you so much, dear Pate. And to all our panelists as well for sharing your views and key messages with us. I believe we've run out of time, and after such an insightful and dynamic discussion, it is now time to draw this event to a close. And before I give the floor to Dr. Leslie Onion for the closing remarks, the Secretariat just reminded me to please to all our attendees to complete the post-event survey at the end of this event. So with that, I would like to now invite Dr. Leslie Onion, head of the Chemical Safety and Health Unit at the World Health Organization, to take the floor to provide some closing remarks. Maybe 1 minute, dear Leslie, over to you. Thank you.
Thank you, Gabby, and thank you for the strong commitment that's been voiced by our representatives from Jamaica, Gabon, and Senegal, who've really spoken a lot about the need for this continued and strengthened collaboration between the Ministry of Environment and Health, not only nationally but also at the international level between WHO and UNEP. And we see that this project is designed to deliver on that. I think we also heard the importance of this project not only from the Minamata Convention, but also for achieving the SDGs, and particularly the SDG 3 on health, and for achieving universal health coverage for tackling non-communicable diseases. So the Minamata Convention is a very strong driver in its own right, but these other health-related goals are, I think, equally strong drivers. So we should all be proud of achieving on that broader front. The need in a number of areas for joined up work, in particularly the healthcare waste management and the awareness raising on a number of these issues, and strengthening regulatory compliance between the different ministries at the national level. I think that those are some of the other points raised. We have run out of time. My colleagues, apologies for not being able to provide more detailed concluding remarks, but I think that this has been a very good opportunity to demonstrate the commitment at the country level and internationally, and also to express our strong desire and hope and for the future in delivering on these three projects, which are very important from a health perspective as well as from a Minamata Convention perspective. So thank you all for your participation this afternoon, and thank you very much to our country representatives for joining, and to our colleagues from other organizations as well, and different parts of WHO and UNEP. Thank you so much. And thank you, Gabby, for doing a great job in moderating.
Thank you, Leslie. Thank you, everyone. Goodbye.
Bye-bye.
Thank you.
Il faut envoyer avant qu'on